everyone. I hope you can hear me and that you can see my screen. If not, feel free to interrupt me. Thanks for having me in this conference. I'm so glad to be here. So I'm going to be presenting our evaluation of the Philippine National Unified Health Research Agenda. Um, hmm. Okay, some disclaimers. The study was funded by the Philippine Council for Health Research and Development, or the PCHRD, and I declare no conflicts of interest with regards to this study. So just a backgrounder, the National Unified Health Research Agenda of the Philippines, or the NURA, is a 6-year cyclical advocacy document. It's meant not only to guide the nation's health research activity, but also to generate research support and promote research translation. Research agenda evaluation, despite being an important policy tool, is actually quite uncommon. But in the Philippines, we've always done an interim evaluation of previous versions of this document. So the 2017 version has 6 broad research themes and 42 subtopics. So we evaluated the NURA 2017 in the following evaluation areas of advocacy, relevance, effectiveness, and impact, using the following evaluation questions flashed on the screen. So we had 2 phases of the evaluation. The first was to develop an evaluation plan. So we did this in 3 parts. The first part was to do a scoping review of how research agendas have been evaluated in the past. So we screened almost 1,800 documents, and we included 6 for review. We also included a policy review to understand the organizational context of how the NURA is implemented, and we included 5 policies for this. When we drafted the evaluation plan, it then had to be approved by the Research Agenda Management Committee. After the approval of the evaluation plan, the actual evaluation consisted of 46 interviews with research stakeholders across 9 regions of the Philippines, as well as an analysis of secondary reports from 12 regional health research and development consortium. So moving on to results, when it comes to how they advocated for this health research agenda document, it was mainly done through workshops, conferences, and online activities or through their website. This was usually disseminated at the regional level and was targeted towards researchers, policymakers, and even local government officials. And the primary aim of these activities was to increase uptake and awareness of the research agenda towards the hope that all of the research in the country would be directed towards the subtopics or research themes listed. When it comes to awareness, though, some of the informants we interviewed remained unaware of the NURA despite the numerous advocacy activities. So some of them were honest and said they were not familiar with it, or they only know about the previous version, the 2011 version. But surprisingly, still has a huge adoption rate at 86%. So this means that members of the research, 86% of the members of the research consortium still adopted this research agenda. So why did they choose to adopt the research agenda? There were 3 main reasons. First, they understood that the research agenda reflects the health needs of the country with inputs from multiple government agencies. Second, they did adopt the NURA, but because there were so many subtopics, they needed to only select specific priorities to be their institutional priorities because of the broad scope. And third, alignment is a minimum requirement to qualify for government funding. So in that sense, the research agenda document is not necessarily what drove how these institutions selected research priorities. It was more to access government funding, but it had nothing to do with because these were the research agenda listed, these are the research we're going to do. It was more likely that because the research agenda subtopics was so long, they already had the capacity or had the interest to do that type of research anyway, and it was a way for them to access government research funds. So to contextualize relevance, when the 2017 Mura was developed, there were different ways to make sure that it was relevant. I think the most important here is that they applied a bottom-up multi-stakeholder approach, and it was very inclusive of the region's perspective. In the implementation of this was validated by the Research Agenda Management Committee as well as national level stakeholders. And during the post-implementation phase, there should be steps taken to make sure that the research agenda is dynamic. And all of these together should result in a very relevant research agenda. So for stakeholders, the fact that the bottom-up approach was used resolved the perception that the research agenda, or previous ones at least, were too national-centric. And they very much appreciated the representation of regional perspectives in the document. When asked what most significant health events happened between 2017 to 2022 that affected health research, there were really only two main answers. And the first one was COVID-19, because all of the research resources were redirected towards COVID-19 efforts. And the Mandano 30-year ruling, which is a Philippine Supreme Court decision, which will strengthen the fiscal decentralization of local government. So stakeholders view the Mandano 30-year ruling as affecting health research because a change in how health is governed means an increasing demand for local health systems strengthening research. When we asked them how did the document accommodate these major health events, unfortunately, the document was not revised to reflect these changing health contexts. However, the participants did say that the document was correct and relevant to highlight responsive health systems way back in 2017, especially in the context of the recent pandemic. What they did instead was to update their own research agenda to reflect the changing health context in the country. So moving on to effectiveness, the NURA really functions as part of the larger national health research system, which really aims to produce relevant research, to generate funding, research support, and increase collaboration. And the NURA is seen to, well, it's supposed to contribute to these three outputs or outcomes. So we were able to assess 307 proposals, and these on the right are the 6 major themes of the NURA. So we can see that global competitiveness and innovation in health had the highest proposal approval rate, followed by research to enhance and extend healthy lives. And it shows here that if you're not aligned with the research agenda, you are not likely to be approved, which makes sense. In terms of the subtopics, like I said in the introductory slides, there were 42 subtopics. Obviously, the second column of this table does not show all 42, which tells us that not all of the subtopics were studied. So in summary, I think it shows that drug discovery and development significantly more studied than other subtopics. And I think a lot of topics actually remained understudied or unstudied in the research agenda. So how much did the government fund for the approved proposal? Unfortunately, 35% of the proposals we had access to did not have this data. But in average, they funded about 860,000 pesos or $15,500 roughly, with a minimum amount of 4,500 US dollars and a maximum of around 170 US dollars. But in total, the amount they funded based on the data we had on hand between 2017 to 2022 was around $641,000. Considering only the approved proposals, only 1 in every 5 of these reported having plans or having plans for collaborations or have collaborators. Typically, collaborations are sought because of expertise of one institution that one institution does not have. So our informants said that while collaborations cannot be fully attributed to Zanura, they recognize that it does encourage collaboration just because of the wide range of research priorities listed in the document. But they did name some challenges in seeking collaborations. The first is that there's very limited government institutional support to foster collaboration. So these are usually research institution led. In that sense, they find that seeking collaboration is just more difficult and involves more time and resources. And lastly, for impact, I mean, research agenda setting is foundational to to a lot of research translation framework. We need to know what research we want to do before we actually produce research and translate it and hopefully scale it up to influence policy and practice. We found that some avenues for dissemination include conferences, journals, or policy briefs, but researchers encounter challenges when there is hesitancy from policymakers to publish results because of their fear of public reaction to negative findings. And there is also limited funding support for conference attendance and journal publication. When it comes to evidence-based decision making, it's a good thing that policymakers see research still as an invaluable tool for decision making. So typically, they will build an evidence base based on multiple resources, such as local research, external consultations with stakeholders, global evidence, and other publicly available materials. They have websites to pool all of the research outputs locally, as well, and also hold policy brief writing workshops, which are useful both for researchers and policymakers. But they did name some challenges here. So the first is that researchers continue to occupy a small space at the decision-making table. So outside of presenting their research work, they're not really consulted after that. So they're not really sure after the presentation how their findings are incorporated or accounted for in policy. Second, policymakers continue to perceive accessible local research outputs to be of lower quality compared to foreign peer-reviewed work. Most of the accessible local outputs to them are just is just a website of all of the final reports of the locally funded research, but these are not peer-reviewed, and they have a lot of reservations regarding using that as a policy reference. There's also a mismatch between the research conducted and priorities of policymakers. So often they'll receive a research brief, but it's not quite useful for them since that's not a policy priority for them at the moment. And there's also no monitoring of how evidence is used in policy. So just a few discussion points. So adoption of the NURA was high, but not perceived by research stakeholders to have influence on the funding. So our data show that most research priorities were understudied compared to a select few. In low and middle income countries, our immense resource limitation dictates the need to set health research priorities, but funding is actually influenced by stakeholder interests and evidence needs of policymakers. At the same time, funder interests, especially in the Philippines, which still heavily relies on external funding, is often different from country research priorities, which results in research that has little impact or relevance on our health system. So the implementers of the NURA need to aim for effectively communicating with both local and international funders in order to increase their uptake of the national research agenda. Second, the appreciation for role of evidence is good, but there were gaps observed in terms of researcher participation in decision making, as well as their ability to communicate findings to policymakers. So our government subscribes to the linear research policy relationship, which basically means that research has a direct influence on policy. So in this linear model, the gap is really that research impact is reduced by problems of communication between researchers and policymakers. So they may not be disseminating research in a form that is relevant or accessible to them, which is consistent with the findings in this study. So researchers should ensure that their work is accessible through clear, concise summaries tailored to the policymakers, as well as really work on developing a collaborative relationship with policymakers to increase trust. And this means that researchers occupy the role of being a knowledge broker to influence policy instead of just an evidence generator. And finally, the evaluation exposed a weak system for monitoring the implementation and outputs of the NURA 2017. Research agenda updating is really only possible when it's linked with M&E efforts. So this might include a review of the research performed, what funding allocation has been done for certain priorities, and how research is used in health policy. When we monitor these things, it allows the research agenda implementers to gain insight into understudied priorities, possible research wastage, and discuss and solve implementation issues. It's also really important to involve policymakers in the updating and review to increase its relevance or the relevance of research to them. When research does not address the needs of policymakers, evidence is less likely to influence public health policy and practice. So some study limitations or quantitative and qualitative data were collected at the same time. So it was not possible for interview questions to explain quantitative findings. Some regions, 5 regions, did not submit data despite multiple follow-ups. And there's selection bias in the study because results found cannot be generalizable to the whole country. We also relied on documentations of the region, so we also cannot assess the completeness of the proposal submitted. There were different levels of data completeness observed across the regions. And finally, there was very limited data on research outputs and outcomes. Um, so we based most of our quantitative data on proposals submitted. So to conclude, we evaluated the National Unified Health Research Agenda 2017 using secondary data from regions and primary data through interviews with the research stakeholders across 9 regions. The findings of our study emphasize the importance of mobilizing resources for research, having a robust monitoring system to maintain relevance of the research priorities, and improving the relationship between researchers and policymakers to facilitate evidence-based decision making. So thank you very much. That's it. And if you have questions, you can ask them now or via email flashed in your screen. Thank you very much.